All right. Hello, everybody. My name is Janae, and I'm with Dallas Pets Alive. And this is Buffalo. He's my little foster kitten. And we are foster-based animal rescue, and we work out of DFW, and we pull from shelters into foster homes. And we started primarily as a all-breed dog rescue back in 2012. And then someone convinced our executive director to bring in a community cat mama and her babies. And then the next thing you know, we have more cats than dogs most of the time, especially right now during kitten season. So we love these workshops with Molly. And actually, I'm pretty sure I know most of the people in this call besides you, Leslie. I think that everybody besides some of the last names, I'm not sure if you're my people, but yeah, lots of you guys. I love seeing our fosters and volunteers. So we love these calls and we love Molly. And afterwards, if you're interested in fostering, don't hesitate to reach out. We can help you get you all the supplies you need.
Yeah, absolutely. In fact, just head over to the chat window. And if you're interested in fostering anytime during this webinar, drop in there, I want to foster and your contact info, and she'll get in touch with you. Also, if you look in the chat box now, you'll see I have gone ahead and pre-populated that with some links to some things that I'm going to show you along the way and how we'll apply them.
Awesome. Molly, will you post them again? They're not, I think because I joined maybe after, they're not there
Oh
yet.
shoot, are they not showing? Okay. Maybe it's because I did it in, hmm, let me see. All right, let me just well, is it not letting me do that? There we go. It may make me redo it. Can you see that one?
Go.
Okay, so yeah, it's gonna make me repost them all. I thought if I posted them ahead of time, they would just be there waiting for you. So sorry. I will let me do this real quick here. Those of you tuning in after, apologize for the delay. Stick with us here. And those of you joining after, if you want links to any of this that I'm talking about along the way, just email me, Molly at catbehaviorsolutions.org, and I will send them to you. All right, let's see. Hold on, here's a couple real important ones that I forgot to put in there. Da, 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 da. Having trouble. Did I get isolation crate? Did you get that one? And then Healthy Paw sulfur cream. Okay. And then here's Healthy Paw sulfur wipes. I think this was the last one. Okay. There we go. All right. So, like I said in the chat, you're going to have links to things I'm going to talk about as we go through this webinar. And so check those out. And if you guys will just drop in there where you're from, go ahead and drop in the chat where you're joining us from, and we will get started now. Right. Let's see. Okay. All right, so we're going to talk about from scared to skilled. Feline illness and foster care. And I want you guys to know you can do this. Leslie and I were chatting before we got started about, how when you lose a kitten in your care or something goes really wrong with a sick cat or kitten in your care, it's really hard. I mean, it's hard to emotionally come back from that and want to do that again. But know that, we are going to have failures. Even when we do the best we possibly can, sometimes it's just not what nature had in mind. Sometimes there's more than we know medically happening, underlying. Sometimes it's just too far along. You are going to have failures, and that's okay too. You helped that cat, and imagine what that cat would have been faced with, without having that loving time in your care. So even with failures, I encourage you to stick in there. And so we're going to go through a lot today. And for those of you who don't know me, I'll quickly introduce myself. So I'm a certified feline training and behavior specialist, and I got that way because I was tired of seeing so many cats euthanized in shelters. And so I did a couple things. I started a nonprofit called Cat Behavior Solutions, and you can find that site at catbehaviorsolutions.org. And I started a podcast called Cat Talk Radio. I have amassed the largest database of free cat information out there. We have over 300 podcasts and counting, and it's all about how to care for cats. I interview a lot of interesting people. And then recently we've developed, well, recently in the last few years, we've developed Feline Right at Home, which is a free shelter resource to train shelter staff and volunteers of how to deal with the aggressive cats in their care to make them more adoptable. Now, here's what we're going to cover today. We got a lot to cover. We're going to start. I made what I've called a fosterability spectrum. And it's not really, I mean, anything's fosterable. So it's kind of, but it'll show you kind of what you're getting into. We're going to cover everything from post-op types of fosters, ear mites, hyperthyroid, URI, and calicivirus. And when we get there, you'll see calici is one of many viruses that can cause upper respiratory infections. But I want to talk about that one specifically because we do see that in high populations. So when you get your hoarding cases in and in shelters, calici seems to be the one virus that is more rampant than some of the others. We'll talk about fostering FIV positive cats, chronic kidney disease and diabetes, which are, and hyperthyroid are usually we see in our senior cat fosters. We'll talk about mange, getting to the scary ones, mange and ringworm and FIP and panleukopenia. Stomatitis, I added in, wasn't even thinking about it, but when I was in Texas last week, we were talking about it and it came up, and I thought, oh, we need to cover that too, because that is often something we're asked to foster, and FeLV positive. So we got a lot of different things to cover today. Let's start right away with the feline. Okay, come on. What's happening here? I've got this spinning ball and nothing's happening. All right. Are you guys still able to hear me?
Yes, we can still hear and see.
Okay. So I guess my computer's giving it a minute to think. Whoop,
There you
back
go.
up. There we go. Okay. So,
Molly,
yes.
I apologize. I'm trying to take screenshots as we go. So when you finish a screenshot or when a page is finished, could you give me just a second to grab a
Sure.
screenshot?
Yeah, absolutely. Sure.
Okay. Would you mind going back to the last page? And I'm sorry, I won't do that again.
That's all right. There you go.
Thank you.
Got it?
I just once I went to grab it last time and then okay, got it. Thank you.
Okay. So I did this fosterability spectrum based on, and I gotta say I'm not a vet, okay? You gotta understand that going in. And some people may or may not agree with where I put things on this. So you just kind of get a general idea here with, from left to right on the bottom, the contagiousness, because that's a big factor in fostering. How many of your own pets you have and your ability to keep fosters separated and isolated from your own pets. You need to consider the contagiousness and the amount of time something is contagious. And then on the other side, what kind of medical requirements are needed? Something could be very contagious, kind of like FeLV positive actively and ear mites, but they might not need, in mild ringworm and even sarcoptic mange, They might not need a lot of medical care, but they're more contagious. And so, this kind of gives you an idea of what you might be equipped to deal with. If, up here, again, we have diabetes, which isn't at all contagious, but it could require a lot of medical attention at home. And the same thing with the chronic kidney disease and the demodetic mange. It's gonna require more medical, but it's not as contagious. So you might, like Suzanne is doing, you might screenshot this just so you have it to refer back to, in terms of things that you might or might not feel comfortable in fostering. It's so, so, so important. When a cat comes into a shelter with really any of these conditions, it's very important to get those cats out to foster as soon as possible. And it can be life and death, not because the condition is life-threatening, but because we can't leave a cat with maybe some highly contagious things in a shelter to threaten, the rest of the community. And maybe the clinics don't have the capacity to take care of them. So it's very, very, very important that, that you guys do this and you foster. And I appreciate you being here today and with us.
Molly,
Yes,
I'm sorry, would you mind showing that chart again?
it,
Because
it, it should still be up.
I see you. I don't see the chart.
I see the chart.
Hmm.
Oh,
I see the chart.
you guys see the chart? I see you.
If you're on a phone, you might need to like swipe over.
No, I'm on a laptop.
Hmm. I didn't even know how to fix that in your view. So I just changed the view of all of us to be just me. Did that help? No?
Sometimes what helps is maybe if you accidentally pinned Molly's video on your screen, so then the presentation becomes smaller. You can try like scrolling on those three little dots on Molly's screen and then see if you're able to like unpin her if you're just seeing her.
Oh, no. Now I've pinned her just to try to unpin her. Now I don't know where the little dots went. Oh, remove pin. Okay, so I'm going to remove the pin. No, and I see a little tiny picture of a person.
But no. Here, let me go down a slide and back up a slide. See if that helps you. Did that change anything for you?
No, I'm just seeing you.
Suzanne, maybe leave and rejoin. That
Okay, I'll do that. I apologize, everybody. I'm so
you're so
sorry.
good.
This is weird. I'll be right back.
Okay. And I'm going to continue because we got a lot to cover today, and I don't want to keep you guys eat up your whole Saturday. But we're going to talk about post-op recovery. And if you remember on the chart, this is obviously low contagion. It isn't obviously not contagious unless they're having something else in as well as their post-op recovery. There shouldn't be any contagion. So this is, I think, probably one of the easiest fosters that you can have. I like to foster the amputee cats. This was not one of my fosters. I should have used pictures of them. But Suzanne, are you back with us and can you see?
I am back and I see a little kitty with 3 legs.
Okay, you want me to go back real quick so you can
Oh,
screen cap that?
oh, perfect. Give me 1 second. I'm so sorry to be a pain. I apologize. I just find there's always so much information that if I don't screenshot it and just try to take notes, I don't remember anything.
All right, got it?
Oh, now what is it doing? I'm sorry. Give me 1 second. I don't know why it's.
You know what I can do? If you will email me, again, it's molly@catbehaviorsolutions.org. I'll create a PDF of this and I'll email it to you. How about that?
Oh, that would be lovely. Thank you. And then I won't have to keep interrupting everybody. Thank you.
Because we got a lot to cover today, and I'm
Yeah.
worried that we're going to run really long. So,
No,
and I
perfect.
and so I listed some of the post-op common things that we see in a shelter setting. We get a lot of eye issues. When we get to calicivirus, we'll talk a little bit about how that can affect eye issues. But a lot of times these cats and kittens come in with eye injuries or eye viruses or things like that where the eye can't be saved. And they remove the eye and they stitch it closed. And it's really pretty simple for the cat. And it can change their behavior immensely if there's actually underlying pain behind that eye once that eye comes out. They do really well. They adapt really well as they do without limbs. I have fostered so many amputee cats. I've fostered rear legs, front legs, toes, the whole shagard. So it's yeah, and they're relatively easy. You may have to help the cat, learn and build up muscle, in the limbs that are remaining because they're not used to walking on three legs, but it's super, super easy. Then there's FHO, which is a femoral head osteotomy. I think I say these things horribly, but basically when a cat has a broken hip or a fractured hip, they go in and they actually remove the femoral head in the hip and they recover quite well. It does require cage rest and some things like that. You got to kind of keep the cat not active, but yet you have to keep it moving, just like if you have a hip replacement in a human. And if you have a young hyperactive cat, that can be challenging, but again, not contagious, easy to foster, and they really, really need you. Fractures, when they decide that it's a limb that they can save that might be fractured, it could be set, it could be pinned, it might be none of those things, and that's basically healing time. Degloving, like Janae was telling us about her little kitten, is when the skin has been pulled off, basically skinned. For some reason, we see it on chins a lot. I'm not sure how a cat's chin gets degloved, but I can't tell you how many of those I've seen in a shelter. And tails. And in the case of Janae's foster, this little kitten was in a foster home and the dog bit the kitten and degloved the front arm. So that requires some wound dressing and things like that to try to make sure that open wound doesn't get infected. But relatively easy. And then sometimes with dental extractions, which we'll again talk about with stomatitis, the cats need time to just heal and eat nothing but soft food and require a little more care than the shelter can perhaps provide. So in these, I'm going to kind of follow this rhythm where we talk about what it is that we're talking about. Sometimes we'll talk about some symptoms of things you might see, not in the not in the environment of recognizing these symptoms in your own cat, but in what you might see in a foster to not get alarmed, right? And then what you need to provide in terms of care. So in post-op recovery cats, you need to provide just quiet, stress-free space, a lot of times activity restriction, which can be crates, blocked off sections, rooms, bathrooms, that kind of thing. You'll need to monitor and observe pretty much with everything. Your observation skills need to be really well and monitoring the cats, making sure that they're not declining in their condition. Maybe pain meds and antibiotics, sometimes not. I know some shelters that do amputations and send the cats home with no pain meds, but others do. So it just kind of depends on which shelter you're fostering for. But it's relatively easy to administer, usually liquid, and you just in a syringe stick it in the side of the mouth. So not anything to be afraid of. Might have to do some wound dressing, changing. Hopefully not as complicated as this little dude in my picture. And have really good communication with the clinic and or rescue that you're fostering with. All right. ear mites. So let's start with, what are they? Ear mites are like little tiny spiders. If you look at them under a microscope, you'll see they actually have little legs, and they're in the cat's ears. Probably everybody has seen them. They live in the cat's ears and the tissue around, just like this picture shows. They are highly contagious, especially in a shelter, which is why it's real important to get a cat and foster. We see them mostly in kittens, um, and strays come in, that have been living on the streets. They tend to get them more often. Dogs get them more frequently. Other wildlife carries it. So they are contagious to other species, which is important to know if you have other species pets in your house. They do live in bedding and things like that in the environment, although that's not super common in how they might get them. Usually it's more in direct contact, allo grooming, rubbing on each other, that kind of thing. But again, we mostly see it in kittens with weak immune systems and outdoor or community cats. And multi-cat households, like a hoarding situation where it's gone untreated and it's just spreading rampantly through. So some things you might see in your foster is they shake their head a lot. Sometimes they'll tilt their head in, the ear that is infected. They'll kind of tilt down towards their shoulder. They might be scratching it a lot. You see this dark, crumbly discharge, usually more so than we're showing in this picture. Can be red and inflamed in there, or even have scabs. They can be real sensitive to the touch. Usually they don't like it touched when they have ear mites. When I find a cat in a shelter that's recoiling a lot, if I can, if it'll let me, I usually always look in the ear to see if the ear canals are clean or if they might have ear mites. So what you might have to do, you might administer topical or oral medication. This is one of the most common external parasites. They can look really dramatic and scary, but they're really easily treated and really don't need much once the medication starts. You'll need to clean the ears, and this is one of the links that I put in the thing for you. These are lime sulfur wipes by Healthy Paws Life. And these are excellent to use these little wipes inside the cat's ears to just remove the ear mites that you're seeing in there. Isolate the cat. Obviously, you don't want the cat to come in contact while it's under treatment with your other pets in the house. You want to wash your hands after you clean it. You want to wash bedding and things like that. Monitor for secondary infections, mostly when they're scratching. They can scratch themselves a sore, and we don't want that sore to get infected. So you just watch and make sure no other injuries show up. Really super simple. Ear mites, super simple. Now, hyperthyroid. We usually see this in our senior cats. And it's just like hyperthyroid in humans, right? The thyroid gland just ramps up and it produces, too much thyroid hormone. And they're usually very skinny cats because they lose a lot of weight. You can see a lot of vomiting with hyperthyroid cats. They drink a lot of water. They urinate a lot. And there's underlying heart problems. I have I've owned a hyperthyroid cat and fostered a hyperthyroid cat, both of which we did the iodine treatment, which we'll talk about here in a minute. And in one of them, we saw heart issues as soon as the hyperthyroid was cleared up. But it wasn't too serious. This is, again, an easy foster, usually seniors, which might mean a little bit longer foster. And again, I'm getting my computer wants to think about it day. I don't know why this happens. Like some days my computer gives me this spinning beach ball. Come on, computer, catch up. Catch up. So when and I'll just continue. There we go. You might need to provide daily oral medication. So again, methimazole is what is normally prescribed. It is usually given in a pill. It's a tiny pill. You will need to probably pill the cat daily. It does come in liquid form, although I've never seen a shelter provided in liquid form. It does come in liquid, and it comes in transdermal, where you can just rub it on the ears. But I've never seen a shelter provide that, but it's worth asking the vets for, because rubbing it on the ears would be a whole lot easier. We monitor for side effects like vomiting, facial itching, and appetite changing. So we watch for the facial itching because the medication, that thiamazole, it can be a sign of allergic reaction when they start scratching their faces a lot on this. It's not common, but it can happen. And they'll get like really serious itching around their face and neck. And so we want to watch for that. Weigh the cat weekly to ensure they're not losing too much weight. We want to track their appetite, water intake, and litter box habits. And you'll need to attend follow-up visits for blood work. Possible radioactive iodine. It's called I-131 treatment. Now it's considered the gold standard, for treating hyperthyroidism. And it's a one-time injection, and it destroys that overactive thyroid tissue without harming those surrounding areas. It's like a 95 to 98% cure. And the cat will actually regrow healthy thyroid tissue. It's super wonderful. It's super expensive. Not every rescue can afford to do it, but if they can, it's the thing that you want to do. And what happens is the cat goes to a specialized center or clinic that does this radioactive treatment, and it has to stay there, for a little bit, usually 1 to 2 weeks or so, for that to clear their system. Well, at least clear enough for you to take the cat back. They have to handle it with specialized PPE in their care. In fact, I think it's a week minimum is the radiation safety laws. And then once the cat's home, we recommend that you use flushable litter, and you want to not be around the cat for long periods of time for that first week or two, just because the cat has actually still got the radioactive material in it, and we want to make sure that you're not getting that exposure. But other than that, super, super simple for hyperthyroid cats. Now, URI and FCV, which is the feline calicivirus. Now, you guys too, I'm not monitoring our chat. So if you put something in chat, I see the chat's happening. If you put something in chat and it's relevant, please tell me, so that just go ahead and unmute and chime in. That would be great. Okay. So you guys might recognize some of these kittens I'm posting and cats I'm posting. So URI is what we call a general term for any respiratory infection. It stands for upper respiratory infection. And FCV is a specific virus, the calicivirus, that causes a URI. And it's like, feline herpes virus and things like that. There are lots of other things and bacterias that can cause URIs. But again, I want to talk about calici because I think it's more prevalent in shelter settings where a lot of our foster kittens come from. So I've made a chart here of the general differences between just a URI and calici. And one of the things I want to point out is we see ulcers usually with calici. So in the mouth, you'll still see some redness in the throat and whatnot with URI, but you'll see actual ulcers in the gum and mouth tissues. And that can spread to the eyes. So you'll see cloudiness in eyes and things like that. Both of these are contagious. URIs are absolutely contagious. They are airborne contagions. They are a virus. We do give, antibiotics, not to really treat the virus, because just like with us, when we get a cold or flu, antibiotics aren't going to do much because they treat bacterial infections. But when a cat has a URI, or specifically calicivirus, its immune system is compromised and it can get a lot of other things. So we give them antibiotics to basically treat any underlying conditions that might develop. So with URI, look at this poor guy. He's so pretty. You guys didn't snag him, did you, Janae?
I don't think so, but I do love him.
Isn't he awesome? He was a DAS kitty.
Oh,
So you need to isolate again because it's highly contagious and do good hygiene. Um, Isolate for 7 days or until asymptomatic, right? Wash your hands, change clothes, sometimes or put on an apron when you go into the room and then just take the apron off. You don't have to do a full clothes change. Definitely separate litter, dishes, bedding. You want to keep these cats warm, well hydrated, and well fed. So I recommend feeding canned food to these guys. They don't feel real well and they can't smell real well. So it's real important that the food be super stinky. So warm it up so that it makes the smell come out more in the canned food. Get the stinkiest canned food you can, because what we really don't want is these cats to stop eating. Providing a humidifier really helps, or if you have a bathroom that they're staying in, run hot water in the shower to create a humid type environment. That's going to really help with their congestion a lot. You want to wipe their eyes with just a warm, damp cloth to get, like, don't you really want to do that to this poor little dude? I just want to take a warm wash rag to his face, give him some relief there. Oral antibiotics, again, not because it's really treating the virus, but because it's helping with any underlying things that might develop. And if they end up with conjunctivitis, which is, an eye infection, you may have to put ointment in the eyes as well. And usually that feels good once the ointment gets in the cat's eyes, so it's not that difficult. And of course, communication if symptoms get worse. Communication is so key in fostering, especially medical cases. So I've made another comparison chart here on some of the differences of calici and URI in terms of care. And the big thing that I want to point out here that seems kind of weird is we watch for limping in calici because the virus can actually localize in joints and cause inflammation in joints, which cause difficulty in moving. And so we watch for limping. If you have a cat with a URI and it starts limping, it may have specifically calicivirus, which, is more contagious and can become more serious. So we really want to watch that. Again, the mouth ulcers may cause some drooling, may make it really hard for cats to eat because it hurts when they eat and they've got all those ulcers in their mouth. You may need to provide pain medication for calici cats for the joint pain or the ulcers. And again, there might be a higher likelihood that the cat doesn't want to eat because of the pain in the mouth. So you might need to do some syringe feeding and that sort of thing. Little bit longer isolation with calici, 2 to 3 weeks, because again, it's a little bit more serious of an infection that takes a little longer to clear. It can also, calici can contribute to stomatitis, especially if the cat's a chronic carrier. So just keep that in mind and things that we want to watch for. Now, FIV, feline immunodeficiency virus.
Molly, I'm sorry. I'm sorry. A quick question about the calicial
Sure.
virus. Is that something the shelter will tell me the cat has?
Not usually, because I'm not even sure. And I should have checked with the vet before we came on here. If there is a way, and Janae or Caitlin might know, is there a way for shelters to actually test for the specific differences? I think they guess more likely than not. We kind of open the mouth and go, "Oops, there's ulcers, so it must be Khaleesi." And or eyes, if the eyes get ulcers on them from the Khaleesi virus, if you can treat it with ointment, that's great. If it's a behavior cat, you can't treat it with the ointment. That's going to probably mean eye removal, and so that becomes an interesting consideration there. But usually I think they just look for ulcers, and that's when they go, yeah, it's Khaleesi. I don't know that there's an actual test.
So if they tell me the kitten has URI, hopefully that's all it is. But if I notice the eyes are super gunky and there's ulcers in the mouth, then it could be something more serious. But hopefully they will have told me that.
Yes, exactly.
Okay, thank you.
Hopefully they will have looked. And when they get their eyes can be super goopy with just a regular URI, but you'll see cloudiness in them when it's an ulcer on the cornea from Khaleesi. And it's usually the other thing too is Khaleesi, goes longer. So if a cat has a URI in a shelter and it's been 2 or 3 weeks and it's not responding, antibiotics aren't nothing's helping, and the cat continues to be sick, oftentimes we'll assume that's got to be Khaleesi. So I think it's usually assumption. I will ask one of our vets and follow up and let you know that, but I don't believe that there's any actual medical test.
Okay, thank you so much.
Now, FIV, so there's stable FIV and then symptomatic FIV. And it's important to know when you're fostering an FIV positive cat, which you're dealing with, because that initial FIV infection doesn't really show many dramatic symptoms, but they get like a little fever, they might be tired, they might have enlarged lymph nodes, although like us, I don't know how you're not gonna really be able to feel that and see that, but those symptoms quickly go away when they get initially infected. So we don't really know until they're tested. Now, shelters typically do a combo test of FIV and FeLV to know, and a cat can be positive for both, or it can be positive for one or the other, or negative for both. So the shelter does know this. There's no test to know if they're symptomatic other than just looking at them to be able to tell. But over time, that virus that's living in the body, it's kind of like HIV in humans. The virus will live in the spinal fluid, spinal columns, and then stress is one of the things that can often bring it out and cause symptoms to happen. But what it basically does is it impacts their immune system. And so it leads to a decline in that cat's ability to fight off secondary infections, which is normally what we see next in an FIV positive cat, like a URI or bacterial infections or ringworms or things like that. And it can be an AIDS-like stage where the immune system is severely compromised, making them susceptible to other diseases, including cancers. So, it does affect their immune system, but it's not easily transmitted, okay? It used to be thinking that, oh my gosh, FIV positive cats, they've got to be totally isolated. Not true, because it spreads through exchange of bodily fluids. Again, very similar to HIV in humans. And in cats, this means deep bite wounds, not just scratches, but deep bite wounds, and mating, of course, which are pretty uncommon in altered cats and indoor cats and cats that are not fighting. Cats usually fight because they're unaltered. So it's not contagious to humans, dogs, or other species. And it's certainly not a death sentence. FIV cats can live a normal lifespan, as long as you keep them indoors. And if you have an FIV positive cat at home, that's your cat, you might be careful about what you foster in terms of things that are highly contagious, knowing that your cat's immune system is compromised and you don't want to expose it to other things that it might more easily catch than a healthy cat. So you may need, here goes my computer again, just giving me the spinning ball. So you might need, we don't normally need to give an FIV positive cat medications. There's really not any care whatsoever unless the cat develops a secondary infection. FIV positive cats can absolutely mingle with your cats unless, you know, your cat is immunocompromised. Even in shelters, we're seeing, we mix in group rooms FIV positive cats and FIV negative cats because everybody's altered. So, you know, we don't worry about mating and or that serious fighting. You do want to provide a stress-free indoor environment. Again, stress can cause that infection to come out. And of course, if they're outside, they're going to be exposed to a lot of other things. You want to feed a high quality diet. And because, you know, they can get oral inflammation and things like that, and that can progress really quickly in cats with a immune compromised system. So things like gingivitis, stomatitis, just plain periodontal disease, they're going to be more common in an FIV positive cat because their bodies have a harder time fighting off the bacteria that naturally live in a cat's mouth. So we kind of want to make sure we're feeding a high quality diet with these guys. You want to address minor illnesses or wounds quickly. If you see your FIV positive foster starting to get URI symptoms, we need to treat that quickly, not thinking, oh, it'll just pass. And obviously keeping up with regular vet care, dental cleanings, exams, things like that. Just know that this is a cat with a compromised immune system. So just like we would with a human with a compromised immune system, we want to make sure that we're not exposing this cat. And I should mention too that when I say feed a high quality diet, I don't mean raw food. An FIV positive cat should probably not be on a raw food diet, but a high quality canned food diet would be perfect. Now, chronic kidney disease. Again, this is one of the most common things we see in our senior cats, and the kidneys stop processing, right? They stop filtering waste from the blood, which is what they do. That's their function. And when that waste is left in the blood, it becomes toxic to the cat and causes imbalances in the cat's hydration and electrolytes. And, you know, with age, kidneys lose the filtering ability naturally. That happens. Hypothyroidism, diabetes, and hypertension are all things that can damage kidneys and reduce their functionality. And there are breeds like Persians. Persians are much more prone to chronic kidney disease. Toxin exposure, like if they happen to get into antifreeze or some certain medications, can cause, you know, a decrease in the kidney's ability to function. Urinary tract infections, other bacterial infections, spreading from dental issues can all damage the kidneys. And a buildup of protein in the kidneys, known as oh gosh, I can't say this word, amyloidus, I'm just not even gonna try, can impair function. And that's why we want low protein foods, right? So some things you might be seeing in your foster: increased thirst and urination. Obviously, they drink a lot more because their kidneys are compromised, and they urinate a lot more. That's normal. They lose weight. Their muscles may be atrophying. Sometimes we see some vomiting. Appetite can be an issue. So again, feed stinky, wet foods. You get bad breath, uremic odor. So cats with advanced stage kidney failure, they're going to develop a strong, it's an ammonia-like odor is what it smells like to their breath. You might see some occasional vomiting. They're a little lethargic, more lethargic. They don't have as much energy as a cat without kidney disease. But your job is to just keep them stable and feeling good. And it's really simple. A chronic kidney disease cat is simple, mainly making them happy and comfortable until we find them a home. You do want to feed a prescription diet, um, low in phosphorus and protein, because the kidneys, when the kidneys lose function, it's those things that the kidneys have trouble filtering out. And it's hard because when you feed a low protein diet, cats are like, ugh, because obviously cats need a lot of protein. So it's hard. You might need food toppers. You might want to go to your lick and lap as a good food topper for a chronic kidney disease cat. Fresh water at all times. It's very important. And what I do, I don't use a fountain. A lot of people think, well, fountain is going to attract cats. I don't do that. Cats also, they have a lot of bacteria in their mouth naturally. And so when they drink out of a bowl, it backwashes their spit into the bowl. And so after a day, your water bowls feel slimy, and that's actually bacteria growing on the surface of the bowl. So I have these bowls. They're ceramic bowls. You can get them in a pack of 6 on Amazon, and I just change out the bowl every day, and I just throw it in the dishwasher. I scrub it, throw it in the dishwasher, and he gets a fresh, clean bowl every single morning. And I suggest doing that with your kidney disease cats because we want to make sure that they are well hydrated. You may have to administer subcutaneous fluids, sub-Qs, we call them. And that's really scary for a lot of people. And it doesn't need to be. What I recommend that you do, and the cat gets really used to it. So it's not something for you or the cat to be scared of, and make it a fun time. So what I suggest you do is get one of these little lick mats. See, it's got ridges in there and it's got suction cups on the backside. So put it against a wall or the floor and then smear the lick and lap all in it and let the ridges slow it down so that you have more time with the cat distracted, having a wonderful thing. And while you're administering the sub-Q fluids, we want to always pair our medical treatments with something wonderful, so that the cat isn't afraid of them. But sub-Q fluids are easy. The vet can show you how to do it, or the rescue can show you how to do it. It's not something to be afraid of. And it makes the cat feel good. So the cat will end up liking it. I will tell you, warming up the fluids a little bit before you administer them is another trick. So, put like those bean bags in the microwave and get those really warm, and put your sub-Q fluids in between those 2 bags to warm up the fluid in there. And that way it's not cold when it goes into the body. Monitor their appetite. We got to make sure they're eating and getting plenty of hydration. Monitor their litter box habits. You might need to give meds, but rarely. These would be things like antacids, or if they're vomiting a lot, or things like that, or phosphate binders. Now, I like to use a Pacatin, EPA Pacatin. Again, email me if you want a link to that. I should have put that in the thing also, but that's a phosphate binder and it's flavorless. You just put it on their wet food and they don't even know it's there. And it just helps bind the phosphates and makes the kidneys process a little easier. And weigh them weekly. A really easy way to weigh a cat is you get on the scale and then you get off the scale and then you pick up the cat and you get on the scale again and you subtract the 2. And that's what the cat weighs. You don't have to try to get the cat to stand still on the scale. Okay, come on, let's go. So this is supposed to be a list of supplies that you might need, and it includes the sub-Q fluids, which is, the syringe and the bag and the hoses and that kind of thing. Again, your rescue is going to supply those for you. You'll want to get the lick mats, and you'll want to get some lick and lap because this is really good and smells great and cats love it. Get stocked up on that. You want to have warm bedding. These cats often run cold, so you might want to get a heated bed for them. We talked about treats to distract them and the sub-Q kit. Water fountain here, but again, I prefer the clean bowl every day because water fountains are ridiculously hard to clean. So I really prefer absolute clean bowl of water every morning. Prescription food. There's also now Weruva is making a low phosphate diet. I highly recommend that. There are several brands out on the market now with low phosphate foods. Then you don't have to use the prescription foods. All right, so again, that one's pretty easy too. Now, diabetes. Why is my computer doing this today? Come on, computer. Diabetes is another one that's pretty easy to foster. It also, we'd see it in middle-aged cats, usually cats that are obese, because just like with people, when a cat is overweight, it throws their ability to produce insulin down, like this guy, right? So they can't regulate blood sugars properly, just like with people. So therefore, there's not sufficient insulin production. Again, they're usually overweight. And so, you might go, oh, I can't do insulin. I can't do insulin daily, but it's really simple. Once you set up a routine, it's easy to do. And these cats can live long, happy lives and go into remission. A cat with diabetes can easily go into remission. Some of the things that we might see, again, we're seeing this increased thirst and urination. They might be losing weight, even though they have a good appetite, but that we see more commonly with hyperthyroidism. We want these cats to lose weight, absolutely. We might see weakness in the back legs, and that's due to what we call diabetic neuropathy, and it's a complication where nerve damage occurs in the hind legs with this. You might see increased urinary infections, and that's due to high blood sugar levels, makes them more susceptible to UTIs. Elevated glucose levels in the blood and the urine create a favorable environment for bacterial growth, and a weakened immune systems that also gives them vulnerability there as well. So you want to watch for those things. Now, what you'll need to provide is going to be slow. Coming up again, here we go. You'll want to give insulin on a consistent schedule, what they tell you. Usually it's 2 times a day. It's a really tiny needle. It's no big deal. It goes fast. But again, use the distraction mat, the lick mat with the lick and lap, and you'll be set to go. You need to feed these cats low carb, high protein meals. And that's because we need to get the carbs out of their diet to try to reduce some of that weight and higher protein so they can build some lean muscle mass. And we usually time that with injections. And again, that can be a reward. You get this wonderful treat while you're getting your injection, and then you get your meal. And the cat will learn very quickly that the insulin giving is not a big deal. We got to monitor their appetite and energy levels. We check for signs of hypoglycemia, which is too much insulin. And it's really hard to regulate daily changes in cats. So we watch for symptoms like glassy eyes, tremors, also loss of appetite or vomiting. And if we see that, the best thing we can do is give them Karo syrup on their gums, right? That sugar will help. I had a cat that was diabetic, and it would, I'd give him insulin, and some days it'd be great. And then some days, he'd be kind of dizzy and sleeping and wobbly. And I'd go, uh-oh, it's too much. And so give them Karo syrup and they're fine. You can back off. The thing about diabetes in cats is cats can completely recover from diabetes, and you never know, one day to the next. So that part can be a little scary, but nothing to be too scary about. Remember, Karo syrup is your friend here. You want to report any changes you're seeing, obviously, to the rescue or the vet team. And some rescues may actually give you a glucose monitor, but I've never seen that happen, and it's really optional. Usually we've got a set schedule of how much insulin to give. All right, now we're going to hit the scary section, which doesn't need to be too scary, right? Mange. Look at this little guy's recovery. Isn't that awesome? Scary looking, scary looking. So mange, there's two kinds of mange, right? In general, it's a skin condition caused by mites, and it's certainly unsightly, but it is absolutely treatable, all right? It's really scary looking. There's two kinds, sarcoptic and nodadric mange. This is considered scabies. You might have heard it called scabies. This particular kind is highly contagious and also potentially contagious to humans, like ringworm. Now, the shelter will tell you, they do a skin scrape, and they are able to tell you which kind of mange you're dealing with, so you know if it's, no big deal, or you might have a little extra work to do with scabies. Usually the cat's just itching like crazy because, you can see all these crusties. They really itch. The crusties usually happen up around the face and the eyes and the ears and the neck, not usually in the hind end. Sometimes lots of hair loss. Sometimes, again, they're getting wounds, second wounds, because they're scratching themselves. Then there's demodetic mange, which is usually not contagious to humans or other animals. And their immune system is typically compromised, and it looks kind of the same, right? They're going to have more hair loss with demodetic and flaky skin, but it can look absolutely the same. And the demodetic just resolves itself with supportive treatment. So sarcoptic mange, the scabies, are caused by the mites that burrow under the skin. And this can actually start in the ears, but not normal mites like we talked about earlier, different. And demodetic mange is caused by mites that live in the hair follicles. So the difference is same mite, but that mite has actually burrowed under the skin with the scabies, and the other is it's in the hair follicles. So the scabies version, obviously strict isolation from other animals. You want to wear gloves when you're handling and treating the cats, and wash your hands after. You need to clean the bedding and litter box areas. You might want to use like a pillowcase over the bedding so that every day you can give them a fresh pillowcase. And you might want to use disposable litter boxes, again, so that everything is fresh all the time. Now, treatments for this, usually topical, sometimes topical and oral. You'll see Revolution or Bravecto or ivermectin given for scabies. Again, these products, Healthy Paw Life's lime sulfur wipes, are really good. You wipe the areas that are infected, and even better, they make a lime sulfur cream. I did put the link to both of these in the comment section. This particular brand is excellent, and a lot of shelters and rescues use it. The cream is, I would recommend with this. In fact, you could probably take one of the wipes and dip it into the cream and then wipe it onto the cat with the wipe, with gloves, obviously. You want to do that daily, and it'll help. You want to monitor for, obviously, this to spread in secondary infections. So it's not that scary, right? It's really not that scary. It looks scary. It's probably one of the most visually scary things we foster. Oh my gosh, what is it? But the demodetic mange, come on. Again, same thing. You'll want to be using either the wipes and or the cream. I suggest you get both and use both with these cats, and just wipe these areas that are infected, and that's going to help kill the mites there. But with demodetic mange, you really don't need to isolate. You want to bathe the cat. I would use the wipes to bathe it with. You want to have immune type boosting care. So again, quality canned food is good here. Monitor it for, they've itched a lot and they've dug another wound in their head, things like that. But shouldn't have anything else happening. And then again, administering those oral or topical treatments like we talked about. So here's a quick comparison chart I made for you for the type of mange listed here, what it's caused by, is it contagious? What are the symptoms? The symptoms are pretty much the same. Again, we see more hair loss with Demodetic. We fostered a kitten that I handed off to one of my other wonderful fosters that had Demodetic mange. And before she was done, this cat was completely bald, completely bald. It was a little black and white kitten. And he had lost all of his hair by the time he recovered. And when his hair grew back out, by the way, it was kind of wavy. It was strange. He had normal fur going in, and then it looked like a Rex or something afterwards.
Oh, wow.
It was different. Sometimes the Demodetic mange is linked to, of course, weak immune systems. So we might see it, you know, in FIV positive cats and things like that. So again, if you have an FIV positive cat at home, even though a Demodetic mange cat does not need to be isolated because it's not usually contagious, you might want to isolate from your cat that's got an immune problem. All right, ringworm, again, one of the big scary ones, but it doesn't need to be. It's certainly not dangerous at all. It's if everybody's probably had ringworm at one point in their lives. It's a fungus, it is not a worm, which makes it a little better, right? We see it in skin and hair and nails. A lot of times, you know, people with nail funguses, it's ringworm in their nails. So it's extremely, extremely common. It is contagious to humans and other animals, but it is not a big deal. Obviously, you get it in direct contact. You can pick it up also from the bedding and the toys and the furniture and clothing. So again, you might want to do the, you know, pillowcase over the bedding that you can wash regularly. It can live in the environment for up to 18 months. So what that means is you will probably want to foster on a hard floor that can be cleaned afterwards. A carpeted room is not ideal because these spores can get down in the carpet in ways that you can't get out. So if you have fostered a kitten, this happens a lot of times. You're fostering kittens and you're like, oh, they're so cute. And then boom, ringworm breaks out. And a lot of the rescues won't let you foster again for a year if you've had a ringworm case because they know that the spores can live in your environment. Others, you know, in my opinion, that just means, okay, we just foster some more ringworm cats. Or again, you have a hard floor, hard surface. Bathrooms are good areas. You can get some crates, you know, keep them up off your carpet. I did put a link to the crate that I like to use, that 3-tiered crate on Amazon. It's less than $100. And that way the cat's not touching anything in your environment. That makes it easy. But don't be scared of ringworm. And it can look just like this, little bald patches of hair. On us, it's going to be a little pink, usually circle, sometimes dry, crusty patch, you know, usually the size of a dime or a nickel on your skin. No big deal. You put cream on it and, you know, it goes away. It could be red, especially on our skin. It tends to be more red and inflamed and a little itchy. You can get a black light, you know, those black lights that they sell to see if your cats have peed somewhere. Well, those also work to look at to see if it's ringworm. So if you have a kitten and it's got some hair loss, a lot of times we'll see it on toes or face or ears, nose. Go ahead and take them in a dark room and do a black light. It's also called a woods lamp, but it's basically a UV black light, and see if it glows real bright. There are some cats that can carry ringworm without showing signs of it. So You want to isolate, obviously, your ringworm fosters. Again, in the crate is the best idea. So those surfaces can be completely cleaned. You'll want to give them oral antifungals, as well as, again, these wipes are wonderful. And the cream, the lime sulfur wipe and cream, just get these on hand so that you have them, you know, no matter what, in case you have a break. You don't have to wait a couple days for Amazon to deliver them. You've got them on hand. The shelf life is long. So like this one, 2027. So go ahead and get these lime sulfur wipes and lime sulfur cream on hand so you have it just in case. You want to, a lot of times they'll ask you to lime dip the cat completely, just so they're getting the whole body done. It's not as bad as it sounds. It's pretty easy to do. If it's a very isolated area, I find that the wipes or the creams will work well too. You want to remove and wash the bedding daily. So use the pillowcases and towels that you can just change out every day. There's also some of the vaginal creams that contain miconazole, like Monistat. Those will also work. But if the cat licks it, it can make them sick. So I don't recommend using that. I recommend using this stuff instead. But, you know, in a pinch, that can work. There's a wives' tale that hydrogen peroxide, you know, you put hydrogen peroxide on the ringworm and it kills it. Do not do that on the cat. You can use hydrogen peroxide on the kennel and in the environment for decontamination, but don't use it topically on the cat. It can burn the skin.
And Molly,
Uh-huh.
what about diluted bleach? That's what our vet told us to use, and it was a disaster.
Yeah,
It took-
never, never, never. We don't want to use bleach, certainly ever, diluted or not, directly on the animal. And we don't use it around cats because it's got so much ammonia in it. It can really damage the lining of their noses. So we recommend instead Rescue. It's called Rescue. There's also Excel. Those are two brand names, and those are available on Amazon. They're antifungal. They're also kill bacteria. And, you know, you do want to clean the kennel away from the cat. If the cat is in the kennel, you put it on a cloth and wipe it down. But never, never, never bleach. We don't use bleach in any areas around cats at all. Wear gloves, because again, it's contagious. But again, if you get it, no big deal. You just put little ringworm cream on and Band-Aid over it to keep it from spreading to other people. It's no big deal. Wash your hands after you've handled. Keep a log of, you know, how often you're medicating and cleaning and that sort of thing. And you want to watch for signs of healing, because that's always good. We want to see when the hair grows back and there's no more visual evidence of lesions. They usually clear within 4 to 8 weeks. 8 weeks is kind of on the long end of it. It's really worse than it is. You know, it's the kind of thing that they have to get out of the shelter, because obviously a shelter can't have a ringworm outbreak. They just don't have the staff. Some shelters have ringworm wards, but those kennels aren't, you know, there aren't a lot of them, and they fill up quickly this time of year because we see it a lot in kittens in the spring. So fostering a ringworm cat is absolutely an amazing thing. And it's not something to be scared about. Get one of those kennels and go to it. Now, the last few, we've got FIP, panleuk, stomatitis, and FeLV to cover here. So FIP is scary. Everybody goes, ooh, FIP. And it usually looks like this. You see these inflated abdomens, bellies. So it is a mutation of a feline coronavirus that causes it. Now, cats are usually exposed to it, especially in shelters and rescues. And most cats, they just get exposed to it and it's like no big deal. But small percentage, usually kittens, then that virus exposure can mutate into FIP, which is a serious illness. Again, most common in kittens, stress cats, cats with immune compromised systems. You'll see it. So there are two kinds, right? There's wet and there's dry. And wet is considered more serious, and both are fatal if they're untreated. So in wet FIP, it's fluid buildup in the abdomen or chest. A lot of times, again, they have this big pot belly appearance. The cat might look pregnant or have trouble breathing. They might have a fever that goes along with it. They're lethargic, they're not eating, they're losing weight. So this can look a lot like URI, like a fat cat with URI, or a kitten. It's really hard in kittens because, kittens eat a lot and their bellies expand. And so we might not be recognizing it as quickly as we should because kittens tend to have fat bellies. And then there's dry. These are lesions that are in their organs, like their eyes and their brains and their kidneys. And we can see neurological symptoms with these, like, they might be wobbly. You might mistake it for a CH cat. But again, that belly is the thing we look for. Their eyes can become cloudy, and one pupil can be more dilated than the other. And then same thing, fever, weight loss, weakness that you see with the wet. So you want to give these cats a dedicated space. There are, well, we'll go on with treatment. We'll talk about that. Obviously, cleaning, maintaining a very clean environment. This is more about secondary infections because FIP cats are like your FIV cats, where their immune systems are compromised, and we've got to watch for other things that could be happening because of it. Keep them comfortable, soft things, warm, low stress, very important. And, appetite. Again, we want to make sure that we're using that really stinky canned food because they might lose their appetite. And we got to make sure that these cats have a lot of good nutrition. And the vet may suggest other dietary and nutritional supplements with it. So there are treatments. There's a GS 441524, and that is a common treatment for FIP. It is now legal in the United States. It wasn't. It was being used in Europe with high bits of success. So now we are seeing rescues able to treat FIP in the United States. But mostly it's kind of a wait and see, things that you can do. You're just keeping the cat comfort. So we might need to do sub-Q fluids and things like that. We want to monitor their temperatures, which you don't have to do a rectal thermometer or anything like that. You can tell by feeling a cat's ears, the base of their ears. They usually run about 102 normally. So you can tell if a cat's feeling really warm. Watch their appetite, make sure that they're eating and they're not losing weight, and we're making sure their energy level is good. And then we want to watch for side effects or worsening of the FIP, which would include vomiting and, swelling if we're doing sub-Q and stuff at an injection site. And we want to bring the cat in for regular checkups as asked. And communication, again, is absolutely key. So sometimes it's just a wait and see. Sometimes, the rescue may be able to do the GS treatments and treat it. There are definitely rescues out there that are doing that. Now, panleukopenia, also known as feline parvo, feline distemper, feline parvovirus. You can hear it referred to in a lot of things. Panleuc is what we typically cause it. It's certainly life-threatening without intervention, but treatable with early care. It's basically FeLV, which enters certain cells and changes their genetic characteristics. That's what panleukemia is. It is related to canine parvo, and so it's rapidly dividing cells in the bone marrow and the GI tract. It destroys the cat's white blood cells. So again, a really weak immune system with panleuc cats. So panleukopenia actually translates to all white cell low, which is why we call it panleukemia. It is highly contagious and it's resistant to most disinfectants. It can survive in the environment for over a year. Now, the good news is, it's not going to be highly contagious. Your adult cats are probably immune to it. But if your adult cat has a compromised immune system, you certainly do not want to have a panleukemia cat around. Often we don't know that the cat has panleuc until, later. Symptoms are very similar. It's very important that we know early, but we don't always know. So we isolate the kitten. And isolation is something you should do with any foster. When you get a foster, we don't know what's going to pop on that foster. I keep my fosters totally isolated for at least 2 weeks before I let them interact with Pico, because I don't know if they might have some ringworm that I didn't notice, or things, brewing in there that come out later. Clothes, again, maybe an apron or washable clothing. Wash your hands. You want to use disinfectants. In this case, they do recommend a bleach dilution, but I really recommend Rescue. I don't like to use bleach around cats. I would only use the bleach dilution after the cat is gone from your care and you're cleaning up the environment after the cat. Rescue is fine to use while the cat's there. Medications that they might be giving you, either oral or injectable, whatever the vet tells you. Again, monitoring hydration, weight, and stool output in this case. And these are hard, so be emotionally prepared, because not all kittens survive it. And a lot of times, again, we don't really know that the cat has panleuc. We just know we've got a really, really, really sick cat, and the cat may not survive, and it was probably panleuc. We do get panleuc outbreaks in shelters and communities, so it's not uncommon. So stomatitis is an autoimmune reaction where the cat's immune system overreacts to normal plaque on the teeth. So, all cats have plaque and tartar and certain level of gingivitis, like we do. But then the immune system goes, oh my gosh, and overreacts. And so it will attack the gums, sometimes the cheeks, the back of the mouth, the tongue. It's also can be known as feline chronic gingivostomatitis. See, I told you I'm like terrible at these words. I never made it through vet school. And it can lead to extraction of all the teeth. We don't really know what causes it. I have no idea, but we know that, if a cat's got dental plaque and tartar buildup that gets extreme, some cats react to it, others don't. Viral infections, again, I mentioned calicivirus or feline herpes virus, which can cause URI also. Those can lead to stomatitis. FIV or FeLV infections, stomatitis can happen with those. Again, a cat has a compromised immune system for some reason, we can see stomatitis. Now, it is absolutely not contagious to your other cats, so you don't need to worry about that. But we see it in cats that have immune compromise, or their immune systems are compromised, so there might be something else going on with that cat. Like the one that we had in the shelter recently, horrible calici case. And this poor cat had ulcers in both eyes and stomatitis, and had been in our behavior program for over a month. So without someone willing to foster a behavior cat that was going to need a double enucleation and all of its teeth pulled, the cat didn't have a whole lot of positive outcome in the shelter. So typically, when we are fostering them, some of the things we might see is bad breath, because again, it's all that gingivitis in there. Drooling, they might be pawing at their mouth because it hurts. And of course, they don't want to eat, because when they put stuff in their mouth, it hurts. weight loss. They're not grooming because it hurts their tongues. And you'll see, swollen red gums or mouth ulcers. So you may be asked to foster a cat with stomatitis, before the extractions are done or after. So we typically will give anti-inflammatory medications, sometimes antibiotics, just again to prevent secondary infections. Sometimes pain management, usually a little gabapentin is good. Immune modulating drugs in severe cases, maybe you may have to do that. But typically it's dental extractions. And most of the time it's a full mouth dental extraction. So fostering these cats is mostly how do I get them to eat, because obviously, just like us, when we had all our teeth pulled, it's not going to be very comfortable in the beginning. But as soon as that recovers, you'll see dramatic improvement in these cats. Soft food, blended food, baby food, that kind of thing. You might have to syringe feed just to get them started. Lick and Lap, I like to use Lick and Lap as a food topper. One of the things I didn't show you when we were talking about some of the things that were highly contagious, in addition to those bowls, you can buy these. I put the link to these little stainless whisker-friendly bowls. They're about $2 a piece. You can get them in a set of 8. Fresh bowl every day so that we don't have the things that are contagious living on these. And you just wash it off, throw it in your dishwasher. Again, you want to make sure these cats are eating, low stress environment, quiet space, but they do not need to be isolated from your cats at all. This is one of the ones that probably should have been more up in the front because there's not really a lot that you need to do other than just help with post-op care and help keep this cat, very comfortable. So FeLV, this is feline leukemia virus. And it is a virus that attacks the cat's immune system and bone marrow, and it makes it a whole lot more vulnerable to other infections, anemia, and cancers. And so typically, the cat is not going to die from FeLV. It's gonna pass from something it got from having a compromised immune system. Very similar to what happens in humans. It is species specific. It only affects cats. It is not contagious to other species. It is spread through the saliva, snot, grooming, shared food and water bowls. So typically we say we want to have FeLV positive cats in environments with other FeLV positive cats. It's not airborne, however. It is still a saliva spreading, thing. It's usually cats aren't going to get it quickly. They've been in the environment together for a long period of time. A lot of cats were exposed as kittens before their immune systems fully matured, and then we see this later. Come on, computer. So if you're going to have them in an environment with cats that are not FeLV positive, feed them separately. Don't give them shared food and water bowls. And water bowls are hard to keep cats from sharing, but definitely separate food bowls fed in separate areas that will help keep that to a minimum. And we see bonded cats doing allo grooming, but if you're fostering, your cats are probably not going to get that bonded that quickly. So you may not need to worry about it. So there's a couple outcomes when a cat is initially exposed to the FeLV virus. It's very easy that the cat's immune system just clears the virus and nothing happens. The infection can also live in that bone marrow. Cat can be FeLV positive, but the cat never gets sick or develops symptoms. Or that infection progresses, that virus replicates, and then that cat's persistently FeLV positive. They're vulnerable to respiratory infections, gum disease, poor wound healing, all the things we would typically see with a compromised immune system, anemia, lymphoma. They say that FeLV cats, life expectancy is 2 to 5 years once they get a diagnosis, but some live a normal lifespan. You never know what you're going to get. 8 years is kind of what I've seen as the average. But it's very important to foster these cats. There are people that adopt FeLV positive cats. I have a vet tech that lives nearby that takes FeLV positive cats. She didn't have any trouble with it because that's all she has in her home. And so you might have to foster for short term until a home is found. Come on, computer. I'm so sorry for this delay today.
Molly, I have a question.
Yes.
Hi, it's Colleen. Hi.
Hey, Colleen.
If a cat has the latent form of FeLV where it's present, they test positive, but they're not sick, are they contagious then? Is their saliva contagious to other cats in that situation?
I think so, yes. But it'll still read as positive, even if it's latent. And somebody in chat may have answered that for us. Let's look. Did somebody answer that? Because no, it's a thank you. Okay. So, some of them, again, can be really healthy. When we see them in shelters and they pop with FeLV positive, a lot of times we don't see any symptoms at all. But a lot of times they'll have upper respiratory infections. They won't be grooming themselves properly, or they don't have real good skin condition under the coats, so their coats can look poor. Weight loss, pale gums because they can be anemic, diarrhea. They can just be, real tired all the time. But monitor them. There's not a lot you really have to do when you have an FeLV positive cat foster. Hopefully it's short-term foster. Long-term, you're going to have to obviously help with some of these secondary things that we might see. You definitely want to use a separate room unless your other cats are FeLV positive. Like we talked about, you don't want to have shared food, bowls, litter, grooming tools, but you really don't have any special handling. It can't spread to other species, dogs or humans or other animals, just cats. You do want to have a high quality diet, mostly for their immune system. These cats should be indoor only, just to limit their exposure to other things they might get because their immune system is compromised. Monitoring is very important. Communication and reporting symptoms of anything else that you're seeing. And you want to make sure that these cats, you don't want to foster an FeLV positive cat and a calicivirus kitten at the same time and have them in a similar space, because these guys have a compromised immune system and you don't want them to potentially get anything like that. Handle them gently because they are going to be more prone to dental issues like some of the others that we talked today and stuff. And so they might just not feel well. So be nice to these cats. But you can do this, guys. Don't be scared about fostering anything we talked about today. You don't need to worry about having a lot of medical experience. Your compassion alone goes a long, long, long way. And it's so important, again, making space in a shelter and getting a cat that especially has some, communicable disease out of a shelter to make room for others, and space and that kind of thing is saves lives. It absolutely saves lives. And as we've said today, it's not scary. You don't have to be too worried about it. Cats are resilient. If they weren't resilient, we wouldn't have over 80 million of them living outside in the community in the United States, right? So they're very resilient. They just need a little bit of support from you to get through this. And remember that you are not alone. Your rescue and shelters that you are fostering for are there to support you every step of the way. And as we talked about, if you are interested in fostering, whether you're interested in fostering potentially a sick cat in need or a healthy cat, drop that in chat with your contact info so that Dallas Pets Alive can follow up with you. So every pill given, every bowl cleaned, every cuddle, it all counts. Absolutely. And you may not be a part of this cat's whole life, but you may be their favorite stop along the way. So don't be scared of it. at all. Now, I know we're running extremely long today, but if you guys would like to chat and talk about some of your foster experiences or questions you might have, I am happy to stay with you. Or if you're ready to get on to your Saturday, I understand that too.
I just wanted to say thank you so much, Molly. This was so informative, and I can't wait to send the recording to some of our fosters who need to see this.
Good, good. I'm glad it helped.
I have a question. Hi, Molly.
Hi, Jen.
What brands do you consider for a high quality diet, just so I know?
I consider high quality canned food to not have byproducts of any kind, wheat, soy, gluten, those types of things. Okay, so there's a lot of brands. I mean, if we were going to talk about what I think is the best quality canned food, the Raw's, R-A-W-Z, the Raw's brand cat food, I think is one of the best. So, but there's many, many, many good quality brands out there. Now, again, if you're fostering a kidney cat, a chronic kidney disease cat with kidney issues, you want to feed a low phosphate diet, and Weruva has probably the best on the market. Cats don't always like it, so be sure to get something really, really tasty you can put on as a food topper to give them incentive to eat. And add hot water to your canned food. All these guys that are sick need extra hydration, just like us. When we get sick, what is the first thing they tell you? Drink lots of water, stay well hydrated. That's true with the cats as well. So be sure to add hot water to the foods that you're feeding. Great question. Anybody else have questions?
So Molly, this is Suzanne again. I'm so sorry. Thank you everybody for hanging with me through my issues there. When everybody else is finished, would you mind going back to that original chart at the very beginning with the 4 squares so I could
Sure.
take a look at that? Because I didn't even get a chance to see what that was.
Yeah, sure. So just stay on when we stop and I'll go back and we'll do that.
Beautiful. Thank you.
Sure.
And I'm gonna jump in because I spaced on the time. I joined you like an hour late. I do this all the time. I need like a time zone chart in front of my desk. But it's been recorded. Molly, are you sending out?
Yeah, it's
copies?
recorded and it'll be on. I won't send it out, but I'll post it on our social media. It might be the first of next week before I get a chance to get it up on. But I have on my YouTube channel, there's a playlist called webinars, and all these webinars that we do with Dallas Pets Alive are there. So there's a whole good library there. So I'll put it there.
Okay.
Yeah.
All right. Because I don't have Facebook. So
yeah,
your
good.
YouTube
Yeah,
channel.
if you follow Cat Behavior Solutions on Facebook, you'll see it come across there.
Okay. And if I don't have Facebook, which I don't, your YouTube channel is
Yeah. Just
okay.
go out to YouTube and shoot, or drop your email in the chat, and I'll make sure anybody who puts their email in the chat, I'll make sure to send you a link to the recording once it gets live.
Okay, that'd be great. Yeah, that's how I got the original notification. So I'll do that right now. Thank you so much.
Yay.
Good to see you.
You too. Anybody else have any other questions before we wrap up? All right, go have a great weekend. Don't be scared. You can do this. Foster some of these cats and save lives, because you're not only saving the life of the one you're fostering, but the one that got the kennel that they came from. So it has a trickle down effect, and you can do it. Thanks everybody for joining us today.